Okay, awesome. Hey, Mary,
Warning.
are you still there?
Hi, Drew.
Yeah. Hey, so thanks a lot for joining me. Maybe be a brief interview, but I wanted to talk to you and ask you questions because I think your story you have some insights that other people can benefit from.
You're
Okay,
you're
I
coming
see
in
you.
and out, and you're frozen. Your voice is in and out, and then it's frozen. Like your face is frozen. Still frozen.
Can you hear me now? Still frozen.
Now I am hearing you a little better. And
Okay.
it's just interesting.
Well,
Whatever you switch to, it's got you in slow motion.
huh. That's funny. I've got a extender for my internet, so it should be okay. So I'll ask you a question, and then I'll shut up, and then we'll wait for the translation in the internet, and then you can answer when you're ready.
Okay.
All right. So I wanted to start off with what were some of the issues that you've been dealing with that led you to reach out to me?
I have been having, more urgently, I had severe knee pain after a minor surgery that didn't go so well, that then precipitated from a variety of circumstances, but mainly my knee going south and developing fractures in my right knee that I needed to have a knee replacement. And knowing that that would be so painful and that I was currently on crutches and needed to find ways to deal with that, I started to reach out to find other ways to manage my pain, and also wanted some techniques to use in the hospital to help me, knowing that just emotionally and physically, I needed to have some extra tools. And then combined with that, I have some autoimmune problems and some systemic arthritis issues.
Okay. Maybe you could say something about how the knee pain and the arthritic pain kind of held you back from feeling the way that you'd like to feel, or how did it interact with your quality of life?
Oh, huge. Like quality of life is, I'm usually a very active person to the extent that I can be, but it just kind of stopped me in my tracks as to doing more limited things. And pain at night and sleeping and quality of life was not good. I was on crutches, for better part of, I had to wait for the knee replacement for a variety of reasons. And I was like 6 months or so waiting and on crutches. And so quality of life was pretty low.
Yeah, understandably.
Both emotionally and physically, I would say, because of it.
Sure. Now, are there physical things that, like, say you felt 100%? What did the knee and different arthritic pain kind of hold you back from doing, like, physical things that you really enjoy?
Walking the dog.
Yeah.
Hiking.
Yeah.
Truly just walking. Like, we live near the Stanford campus, walking just even on the Stanford campus. Yeah. Taking a walk with a friend, biking.
Sure.
No outdoor biking, limited indoor, those kind of things. And then functional things.
Yeah, were impacted. Okay. Yeah. And then what are some of the things that you've tried for help over that period of time?
Prior to researching and finding you?
Yeah.
Okay. Did I PT, physical therapy, for sure.
Mm-hmm.
Counseling for kind of emotional preparation for surgery and different techniques to mindfulness kind of things, and that to help me to try to handle pain. and stress. Of course, doctor's appointments, and water therapy of various sorts, trying to, but on my own, swimming. And then when my shoulder got more impacted, less on that, but, movement in the water, non-weight bearing things.
Okay. So a whole variety of things.
Yes.
Is there anything that helped you, or what was your experience working with these different kind of techniques or modalities?
I would say the physical therapy helped on strength.
Okay.
And that helped, I think, going into the surgery on my recovery, because I'm now, from a muscle standpoint, it's bouncing back quicker, because I had muscle definition when I went in. And again, that was non-weight bearing kind of muscle development stuff. So that helped. Sure. Of course, the counseling helped with the psychological aspects of going into surgery, being in the hospital, and to some extent after.
Sure.
But the pain stuff, not so much. I kind of struck out on other than just kind of meditative kind of things. Okay. And Tylenol and Advil. The traditional.
We don't count those. We don't count those.
I know.
All right. So maybe some help, kind of like emotionally thinking and preparing, and then some help strengthening by kind of like traditional movement. But in terms of kind of managing or trying to relieve some of the pain, it was harder to get a solution. And then maybe you could say, because obviously the work that we do is pretty unconventional. So maybe you could just say a moment or whatever comes to your mind about your experience working with me.
Well, fortunately, I had, when I was talking to my therapist about this and doing the kind of mental preparation, she had heard about Z therapy, and she said, you might want to try that. And I'm like, great, how do I, what is it and where are they? And she's like, well, it's this kind of unconventional, you kind of do these kind of funny movements and stuff, but I found it to be pretty helpful at times. You might want to give it a try, and then like, she didn't know you, but then she started to check around, and then she got back to me and gave me your name. And then when I met you in Oakland in person, the first few times, now this is before the knee replacement, like the 6 weeks or so, maybe before the knee replacement, I'm guessing it was. It was kind of, at first I thought, this kind of wackadoodle.
Wackadoodle. That's going to be the title of this video. Wackadoodle.
I was like, yeah, okay, Drew, I'll try this. I'm game. And I'll stand on my head if it would help to reduce pain. So I was willing to do it, but I just couldn't wrap my head around why I was doing certain things.
Yeah. Maybe you could say, like, what was wackadoodle to you? Because you're not the only one who says that. So what was wackadoodle, and then how did you feel?
Well, we did lots of different things, but I would say one of the things that has been quite effective, and even still, is doing various motions with my, just dropped my ear set, moving my left elbow to try to reduce pain and have more range in my right knee. I'm like, left elbow, why would something doing with my left elbow help me with my right knee?
Yeah.
And when we tried it, even the very first time, I was like, got a little bit more range. I've got a little bit less pain. And that's an example of, I could think of others too, that helped with, I thought, this is worth trying. There's something here.
Yeah, it's interesting. Yeah, same. I had the same experience when I started working with my Z Health trainer, because I had my pain and various things. And then she was having me do vision exercises or move my head and stimulate my inner ear or do some weird movement. I was like, how the hell can this? And then for me, the impact wasn't immediate. I took more repetitions over a period of time before I started
Definitely.
bigger. But
yeah.
We
And
do untraditional. No, go ahead.
I was going to say, for example, also during after surgery, I was in the hospital when, and on pain meds, but you still, because of knee replacement surgery is pretty big. The pain meds can't really take away all the pain, but I was moving my left elbow like crazy and moving all this motion, and it gave me something to do, and it was helping. And all the nurses were like, "Why is she moving her left elbow?"
That's
and then
great.
Of course, some of the breathing exercises you had taught me, I was doing those big time. So
I was going to ask you, from the things that we've tried, what do you think has been the most helpful for you in terms of where you've been able to see like a real a positive impact in helping decrease the pain and get you moving a little bit better and more freely?
Yeah, I definitely, the motion, moving the very, like, for instance, the left elbow, on the shoulder, those have helped, I think, especially when I'm consistent about doing them. The breathing for sure has helped, especially the one on the floor, where I don't know what the name of that one is, but with raising your arms up. But I also discovered working with you just how much I hold my breath. And that was something I hadn't really been, see, I'm doing it now. Haven't been aware of. So those two the most, but I also have to say that like some of the other sensory stuff, and we've only done a few of the eye movement ones, but I thought those were really helpful. And the sensory with the brush, exactly. So feeling that and brushing that. Using your other senses.
For the people who are watching this and they have no idea about the sensory stuff in the brush, that kind of goes to the same idea of giving the body different kind of good stimulation that the brain requires us to kind of move more freely. So sometimes if we have a problem, take for example your right knee, then we'll work the opposing joint, which would be the left elbow. So we can mobilize that elbow, and we can provide other type of sensory input, like using a brush as an example, and that could help with the right knee pain, as crazy as it is, but about it.
And my hip.
Okay, awesome. Pretty interesting.
No, I'm a believer.
Okay, well,
it really helps.
You're a believer. Yeah, right on. We've got more work to do, but I'm glad that we've been able to find some stuff that's been helpful to you.
Definitely.
Okay.
Yeah, and I think that's the thing is it's not I would say, to anybody, it's not a like miracle cure, like this isn't going to eliminate all your problems and have me out running, when that's not physically I'm not physically possible, capable, I guess, to do that. But finding ways to have a higher quality of life and reduce your pain and increase movement, it's a great technique. And I do look forward to working with you more and exploring more sensory things and movement things that would help me on and reassessing what might work for me.
Great, Mary. From my perspective, I was just thinking while you were talking, like, even though we're all kind of built the same, we have the same system, so to speak, everyone is a little bit different. And so what works for someone else, who has a similar kind of history as you do, may be totally different than what works for you. And we only know that through kind of evaluating and assessing. Right. And the things that have helped you the best is doing different body movements, so mobilizing your joints and working the opposite side of your body where you have pain. And then working on breathing, trying to relax, and then doing some of that sensory work, and even some of the vision work has been really helpful to you. So unconventional things, but they do have a noticeable impact.
Definitely.
So that's great. Okay, well, I think that's it on my end, unless you feel like there's something else you think is valuable that someone else may like to hear.
Oh, I'd say personally, you're exceptionally easy to work with and understanding and honest. I like your integrity that, you'll be honest with what you're, propose, and what, like just what you said, what this may work for you, may not, but, and that, it's a combination of the therapy, but also you're a really great coach.
And I didn't even have to pay you to say that.
Shoot,
All right,
I wish I
Barry.
should have asked
Thanks
first.
a lot, Barry. I think it's a little over a 5-minute interview, but I think we can end there.
Okay.
Okay. Thanks a lot, Mary.
Take care.
And we'll talk soon.
Okay. Bye-bye.
Okay.